Did you know some of the worst blood sugar damage in your day may be happening in a glass, not on your plate? Most people are told to fear bread, fear rice, fear fruit, fear carbs in general, but they are never taught that the drink sitting next to the meal can be the thing driving the spike even faster. And the flip side is just as important. The right drink, used at the right time, can bring your numbers down surprisingly quickly. I have seen people improve their readings within a single day just by changing what they drink around meals. Not with a cleanse, not with a trendy powder, not with starving themselves, just with a few strategic drinks that work with your biology instead of against it. Before I get into the first one, do me a quick favor. If you want more videos that explain what your body is actually doing instead of just giving you generic rules, hit subscribe, give this a like, and leave me a comment telling me which drink shows up most often in your day. Coffee, juice, soda, tea, or honestly, whatever is nearby. I read those comments and they help me shape what I cover next. Now let me show you what almost nobody has time to explain in a rushed clinic visit. High blood sugar is not just a sugar problem. It is a signaling problem. Insulin is supposed to help move glucose out of the bloodstream and into your cells where it can be used for energy. But after years of poor sleep, stress, processed food, excess body fat, and repeated glucose spikes, that signal starts getting weaker. The pancreas pushes harder. The liver keeps releasing sugar when it should quiet down. And now drinks become a much bigger issue because liquids move fast. They do not have much fiber. They do not slow down much on the way in. They can hit your bloodstream almost immediately. Every drink in this video does one of three things. It either replaces liquid sugar, slows the glucose surge before it happens, or helps your body handle that glucose more effectively once it arrives. You do not have to use every one of them tomorrow. Start stacking the ones that fit your life, and let me show you where to begin. The first drink is plain water. I know that is not exciting, but if you skip past this one because it sounds too simple, you're missing the foundation of the whole thing. When blood sugar runs high, you tend to lose more fluid. That is one reason high numbers can leave you feeling tired, dry, headachy, and off. Water is not a magic eraser for a very high glucose reading, but it does two very important jobs. First, it helps prevent the dehydration that can make you feel worse and make the whole situation harder on your body. Second, every time water replaces juice, soda, sweet tea, sports drinks, or those healthy bottled smoothies, you just removed one of the fastest glucose hits in the modern diet. This is the drink I tell people to use first thing in the morning and with meals, not because it is trendy, because it works. A large glass when you wake up, another with lunch, another with dinner. If you want flavor, add citrus slices, mint, or use plain sparkling water, but keep the sugar out of it. If the label says 30 grams of sugar, that is not hydration. That is liquid dessert. Number 2 is diluted apple cider vinegar. This one has one of the fastest visible effects on a home glucose meter if you use it correctly. The reason it works is the acetic acid. That acid can help slow how quickly the stomach empties after a carbohydrate-heavy meal, and it also appears to improve the way your body responds to that incoming glucose. So instead of the sugar showing up in your bloodstream all at once like a wave crashing through the door, the rise becomes more controlled. That is why I like this one before meals that you already know tend to spike you. Rice, bread, pasta, potatoes, oatmeal for some people. The practical dose is simple. 1 tablespoon in a full glass of water about 10 to 15 minutes before a carb-heavy meal. But there are two cautions here. First, always dilute it. Do not drink vinegar straight. That is rough on your teeth and your throat. Second, if you are on insulin or an older medication like a sulfonylurea, this can lower numbers enough that you need to watch your readings more closely. Good tool. Just use it with respect. Now, if you have been told every drink besides water is automatically bad for blood sugar, this next one usually catches people off guard. Number 3 is a small whey protein drink before the meal. Not a giant shake, not a milkshake pretending to be health food. I am talking about a small, strategic preload. What happens here is fascinating. When you take a modest amount of whey protein before a carb-heavy meal, it helps slow gastric emptying and stimulates gut hormones that improve the insulin response to the meal that is coming. In plain English, it helps your body prepare for the carbohydrate before the carbohydrate arrives. That means the toast hits differently. The cereal hits differently. The bowl of rice hits differently. The most practical version is about 15 to 20 grams of whey protein mixed in water around 10 to 15 minutes before a meal that usually spikes you. This is especially useful at breakfast because breakfast is where a lot of people accidentally start the day with a glucose surge and spend the rest of the day chasing it. And if you're sitting there thinking, why would a drink help more than just trying harder? That's exactly the point. Strategy beats willpower. A lot of blood sugar management comes down to sequence and timing, not just restriction. Number 4 is Psyllium husk in water. This one is not glamorous, it is not Instagram friendly, and it is one of the most underrated blood sugar tools available. Psyllium is a soluble fiber. When it hits water, it thickens. When it reaches your gut, it forms a kind of internal speed bump. That changes how quickly carbohydrates are absorbed, which helps flatten the rise after meals. Over time, it can also improve fasting numbers and insulin resistance. The easiest way to use it is to start with a small amount, usually about 1 teaspoon in a large glass of water, once a day before a meal. Some people can build up from there. The key is to start low and drink enough water with it, because fiber without enough fluid is not a good idea. And if you tend to snack because your meals do not keep you full, this helps there too. A slower glucose rise usually means a less dramatic crash. Less crash means fewer cravings. Fewer cravings means you stop spending the afternoon bargaining with yourself in front of the pantry. Before I get to number 5, I need to pull one drink off the health pedestal because it fools people every day. Fruit juice is not a blood sugar lowering drink. I do not care if it is fresh pressed. I do not care if it says organic. I do not care if it came from a health food store. Juice is fast carbohydrate with the fiber stripped away. It can raise blood sugar very quickly. In fact, one of the few times juice is genuinely useful in diabetes is when blood sugar is too low and you need to bring it up fast. This is where so many people get blindsided. They stop the soda, which is good, but then replace it with orange juice, bottled smoothies, sweetened iced tea, or those immunity drinks loaded with fruit concentrate. Same problem, different label. So if somebody in your family thinks juice is helping their sugar, send them this video because that one change alone can move the needle more than most people realize. Number 5 is unsweetened green tea, and this is the tea with the best evidence behind it for blood sugar control. Green tea is rich in compounds called catechins. Those plant compounds appear to support insulin sensitivity and may help calm some of the oxidative stress and metabolic noise that come with type 2 diabetes and prediabetes. Green tea is not the sort of drink that usually changes a meter in the next 20 minutes the way vinegar or a whey preload can. It works more quietly than that, but it works in a direction that matters. People make one big mistake with green tea. They turn it into sugar delivery. Honey, syrups, bottled sweetened versions, cafe blends that are basically candy. Once you do that, you wipe out the benefit. So the version I recommend is plain, unsweetened green tea, hot or cold. 1 to 3 cups a day is a very reasonable range for most adults who tolerate caffeine well. And if caffeine bothers you, use decaf green tea. You are after the habit and the compounds, not a racing heartbeat. Number 6 is plain kefir. This one does not get talked about nearly enough. Kefir is a fermented milk drink, and what makes it interesting is not just the protein, it is the fermentation. That fermentation changes the drink, and the bacteria involved may help support a healthier gut environment, which matters much more for blood sugar than people realize. Your gut is not just a food tube, it is part of your metabolic signaling system. It influences inflammation, appetite, insulin sensitivity, and how your body responds to meals. When that system improves, blood sugar often improves with it. Now, I need to be very specific. I am talking about plain kefir, not the flavored kind loaded with added sugar. Those fruity bottles can undo the whole point. The better choice is an unsweetened version. usually around 1 cup, either by itself or as part of a balanced breakfast or snack. This is not the fastest trick on the list. It is more of a steady-the-terrain drink, but I've seen a lot of people do better when they stop treating every beverage like entertainment and start using a few of them as therapy. Number 7 is black coffee, but only if it stays black and only if your body handles caffeine well. This is where nuance matters. Plain coffee has virtually no sugar on its own. So for many people, switching from a sweet breakfast drink or sweet afternoon latte to plain coffee removes a major glucose hit from the day. That part is useful immediately. But coffee is not green tea. The blood sugar evidence is more mixed. Some people do fine with it. Some people see their glucose run higher with caffeine, especially if they drink it on an empty stomach, under stress, or after poor sleep. That is why I call this a conditional tool. If coffee makes your number climb, do not force it. Use decaf or skip it and lean on green tea instead. But if you tolerate it well, plain coffee can be a very good substitute for sugary drinks. The key phrase is plain. Not the caramel thing, not the whipped cream thing, not the bottle with 42 grams of sugar pretending to be coffee. Let me tie these together because this is where the real power is. Water removes the liquid sugar trap and helps you stop digging the hole deeper. Vinegar changes what happens before a carb spike gets out of hand. A small whey preload helps your body prepare for the meal. Psyllium slows absorption and steadies the curve. Green tea helps improve the metabolic environment that created the problem in the first place. Plain kefir supports the gut side of blood sugar control, and plain coffee can help if it replaces sugar and your body tolerates caffeine. Notice what is missing from that list. Punishment. This is not about making your life smaller. It is about becoming more strategic. One of the most common patterns I see in clinic is the person who says, "I do not understand why my sugars are high. I do not even eat that badly." Then we look closer, and breakfast comes with juice, lunch comes with sweet tea, the afternoon comes with a flavored coffee, and dinner comes with a sports drink because they think it sounds healthier than soda. The food is only half the story. The drinks are the ambush. And when those drinks change, the numbers often change faster than people expect. I remember a patient I will call Maria. Early 60s, very conscientious. She thought she was making good choices because she had already given up desserts most days, but she was still doing orange juice in the morning, a sweet coffee in the afternoon, and a so-called healthy bottled smoothie when she got hungry at night. We did not put her on some miserable all-or-nothing diet. We cleaned up the drinks, water first thing in the morning, vinegar before her biggest starch-heavy dinner, a small protein preload before breakfast on the days she wanted toast, green tea instead of the sweet afternoon drink, plain kefir a few evenings a week. Within days, her after-meal spikes were smaller. Within weeks, her fasting numbers looked calmer. And just as important, she stopped feeling like her body was unpredictable. That is a huge part of this. People do better when they finally understand the pattern. Now, I need to draw one very important line. If you take insulin or you take a medication that can cause low blood sugar, do not hear this as, "Great, I will change everything overnight and just wing it." These drink strategies can work well enough that your medication dose may need attention as your numbers improve. That is a good problem to have, but it still needs to be handled safely. And if your blood sugar is very high and you feel sick, short of breath, confused, or you are vomiting, that is not a green tea problem. That is a medical issue. Follow your clinician's instructions and get help when needed. So here is your simple plan for the next 24 hours. First, tomorrow morning, start with a large glass of water before anything sweet ever touches your mouth. Second, if you know which meal spikes you the most, take 1 tablespoon of apple cider vinegar in a full glass of water 10 to 15 minutes before that meal. Third, if breakfast is your danger zone, try a small whey protein drink before the meal instead of waiting until after the spike to wonder what happened. Fourth, replace 1 sugary drink tomorrow with either plain green tea, plain coffee if you tolerate it, or sparkling water with no added sugar. Fifth, this week, Add either plain kefir or psyllium water as your steadying habit. Not both if that feels like too much. Pick one and make it stick. That is how you do this. Not perfectly, consistently. Now, everything we covered today helps the daytime spikes and the after-meal roller coaster. But a lot of you keep telling me the strangest number of the whole day is the one you wake up with. You went all night without eating, and somehow your sugar is higher in the morning than it was at bedtime. That happens for a reason. Your liver is involved, your hormones are involved, and if you do not understand that overnight pattern, you can eat well all day and still feel like your body is working against you. Thanks for watching the video and came back for more.